House is now setting an end date for the COVID-19 health emergency that's been in place now for nearly 3 years. Hard to believe.
Right.
Here to answer questions is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Good to see you, Doctor.
Hey, Dr. T, it's great to see you. Okay, so
You too.
let's get out the national calendar and put a big red circle around. It's May 11th. On that day, President Biden says the COVID-19 emergency declaration will end. Is May 11th? Why didn't you do it May 10th or April 30th? And do you agree with that decision?
I don't think there's any magic to the May date, but I think what he's doing is making sure that people have time, that we all have time to sort of prepare for the end rather than just doing it abruptly. I think ultimately it makes sense. We're not in the same place we were 1, 2, or 3 years ago. It doesn't feel like it's an emergency anymore on a day in, day out basis. So, I think it is reasonable. I think the good news, though, is we live in Massachusetts. And Massachusetts law can supersede federal law. So, for example, Massachusetts has safeguards and laws in place that make sure that they will cover COVID services and COVID treatments like Paxlovid. The fact of the matter is those that are insured in Massachusetts, and that includes close to 98% of us, will still be able to get vaccines free of charge based on the Affordable Care Act. So I think overall, we're not going to see such a great difference in Massachusetts as we saw before. Now, the bad news is that right now, insurers are required to send free tests, and Medicare is required to send free tests to a lot of people. I think that the free testing might not be as great as it was before. So that is one thing that concerns me.
What do you mean not as great? What do you mean by that?
In number and quantity.
Available,
So we're
yeah.
going to
okay. I just want you to clarify
We may
that.
have to pay more. We'll still have access to testing, but it may cost more, now
okay.
than it did before the public health emergency ended.
Let's talk about the latest data from the CDC. Last week, there were nearly 300,000 new cases, 3,800 deaths, 3,700 hospitalizations. The numbers have been declining for weeks now. We need to say that. Are you concerned that they could rise again after this health emergency ends in May?
So, Maria, we know that the numbers will rise again after the health declaration ends, but we also know it will fall again because that's what COVID does. I think what's important here, though, is I'm not as concerned about the declaration ending as I am about the fact that only 16% of the United States have been boosted. Only 40% of those over 65 have received that bivalent booster. So that's the type of issues that I'm worried about more. And we have access to free vaccines right now. So I think that's where my focus is right now.
Is there, pardon this question, is there a concern if the national health emergency is ended that the free vaccines would go away too? I mean, is there a concern about that or no?
Well, again, I think on a federal basis, because of the Affordable Care Act, preventative type services like vaccinations should still be free for at least those that are insured. And again, I think in Massachusetts specifically, we also care about that equity piece. So, the uninsured are prioritized as well. I think we're very lucky to live in this state. I can't speak for all the other states.
You touched on this earlier, that we're living with it, we're used to it, it's been here, and many healthy Americans have been acting as though this thing has been over. But those that aren't healthy, the cancer patients, the older adults, the people with the higher risk factors, in your opinion, will the end of the national emergency change anything for them?
Well, so I think mostly things will be the same. Access to vaccines, and for now, access to therapeutics like Paxlovid. The one thing you heard me allude to before is I'm a little concerned about that free testing, that won't be while testing will still be accessible, there may be a higher charge, and I'm not sure whether people will feel like that's a barrier, and they may say, you know what, I'm sick, but I don't want to go purchase that test because I know it can't be reimbursed anymore. The government's not sending me free tests, so I'm not going to test as much. Why is that concerning? Because we may have people that are out in the public with COVID that are sort of just kind of downplaying it a little bit. Let's face it, we all know people right now that aren't testing, even when they think they may have COVID. So this is an issue, and I hope it's not exacerbated by the next phase.
All right, Dr. Todd Ellerin, thank you so much, Doctor. As always, be well. To our viewers, if you have any COVID-related questions that you would like our experts to answer, it's easy. Just email them to ask@wcvb.com.